Namaskar, my name is Manju and I am a clinical psychologist, and at present I am practicing at Tulasi Healthcare, Gurgaon. So in today's video we will be talking about schizophrenia. So schizophrenia is a very serious mental health disorder where it affects how a person thinks, feels and behaves. So in schizophrenia the person loses touch with the reality, which is very distressing for the patient and their family as well. Now let's understand the symptoms of schizophrenia. So though symptoms of schizophrenia differ person to person, but that can be divided broadly into three categories. So the first category is psychotic symptoms. So in psychotic symptoms there are some changes in the way a person thinks, acts and experiences his or her environment. So basically they lose the touch with reality, what other people are experiencing, and that is how their experiences are distorted, or we can say that not like other people are experiencing. So psychotic symptoms further may be divided into four parts. So the first is hallucination. Hallucination is called when a person is experiencing something without a presence of a stimuli. So let's say a person is hearing something which is actually not there, or maybe other people are not hearing at the same time. There can be visual hallucinations wherein the person is seeing something which other people are not seeing at the same time, and accordingly there can be olfactory hallucinations. Let's say the person is smelling something without the actual presence of that smell. There can be gustatory hallucination, whereas person is feeling some kind of a taste which is actually not there, or like let's say we can say that the person is not eating anything but he is experiencing or feeling some kind of a taste. The fifth hallucination is called as the tactile hallucination. Here what happens is that the person feels some kind of sensation on the skin. So for example, the person may feel that somebody is kind of touching him or her, where in actual nobody is there. So these are 5 types of hallucination which are actually based on our 5 senses, to say ear, eyes, nose, tongue and yes, skin. The second category is delusion. Delusion is basically a false and firm belief which is unshakable and based on inadequate grounds. So during delusion the person had some kind of belief जो family में सबको पता है that is not true, the friends knows, or maybe if a person takes some help of doctors, they also try to make the person understand, let's say that that is not real. However, the person will not understand and accept that because that belief is that strong. Even if we are going to present some kind of evidences to contradict his belief, then also the person may not believe that. It is that firm belief. So during the delusion the person may feel that if there are 3-4 people standing somewhere, so the person may feel that they might be talking about him in a negative way, or the person may think that his own family is against him. If he is having some food at home, he may think that there is something mixed in the food. So basically the persecutory ideas may be present, and delusion have a lot of types. So it can be any kind of a belief which has no reality or which has no grounds for the things to be a truth. So the third category is thought disorder. So during thought disorder the person has some kind of illogical thinking, or we can say the unusual thinking the person may have, and also the way person tries to communicate his message to other people, that may also get affected. So for example, few people may use some new words which has never been discovered. The person may use words which has no meaning as a whole sentence, and a lot of times the person may have thought block also. So let's say that if a person is speaking something, he will stop in between and then he will completely forget that he was talking about something. So these things are some of the examples of thought disorder. The fourth category is movement disorder. So during movement disorder, the person may repeat certain movements again and again, and that will also have no meanings, or the person may remain in a specific position for a longer period of time. So that is basically the movement disorder is. So the third category of symptoms of schizophrenia is the cognitive symptoms. In this, the person's attention and concentration, including memory, gets affected. So for example, the person may not be able to pay attention on something, he will not be able to focus for a specific thing for a longer period of time. The information processing will get affected. Maybe that if the person has learned something, he will not be able to apply that immediately after the learning. Now let's understand how a family can support the person having schizophrenia. So basically, for the family, it is very, very important to first understand the illness, the kind of illness it is, the symptoms which are there in this illness. So it is very, very important for the family to seek help from a professional, a doctor and a psychologist, and to understand the illness completely. Second thing is to listen the patient very carefully and validate his feeling. So we don't have to contradict कि नहीं ऐसे नहीं होता है, or this not happens, that not happens. We do not need to do these kind of things. We need to help the patient that he is being listened and understood. Now the family also needs to stay connected with the patient. So for example, they can go out on a small picnic or something. They can have little outings in between, so that the person feels that he is being taken care of. Encourage the patient to focus on the treatment and to continue the treatment, timely meeting the doctor and the psychologists, so that there is a constant watch about the symptoms of the patient. Now, how should be the communication with the patient? That is also important. Sometimes what happens is that let's say the person is behaving in a certain way which the family members may not be liking, and they make certain comments on the patient, that you walk very slowly, let's say, or you have not taken bath, why don't you do this, why don't you do that. So these things should be avoided, because that is not considered a healthy pattern of communication with the patient. Now we need to be patient with the patient, that if he or she is taking time in a certain task, we need to support the patient and try to help them if the person wants. But again, the initiation should be from the patient's end, that he is seeking help. Do not intervene the patient without the needed help. So after psychotic symptoms, let's understand some negative symptoms which are present in schizophrenia. So why we call them as negative symptoms? Because there are certain behaviors which should be present in a person which are not there. So for example, we talk about 5 things here. So let's say the person have a blunted affect. For example, maybe if you make a joke or there is something to laugh, the person may not feel that happiness and the person may not laugh at the joke. So there will be constant a similar affect or a expression per se on the patient's face. Second thing is alogia. So the person's speech production also gets decreases. The person may not speak much. That is also one symptom. Third thing is avolition. So there is no motivation to do certain goal directed behavior. So the person may not be willing to do something. Let's say he is not waking up on time in the morning, he is not maintaining hygiene, he is not willing to go to work. All these things can happen. The fourth thing is the person becomes asocial, which means that he may not interact with the family members or the friends, let's say. he will not be going out, and most of the time would want to be alone in the room. Fifth thing is anhedonia, which is inability to feel pleasure in previously enjoyable activities. So let's say a person used to enjoy football or cricket very much, but during the illness the person may not want to go out to play or do the previously enjoyable activities as I just mentioned. So yes, this was all about little bit understanding about schizophrenia. Please share this video as much as possible so that the people can seek help. In our surroundings, approximately 1% people are having schizophrenia, so that they can be benefited out of that. You may contact on our website for the further information or our contact number mentioned on the screen. Thank you very much.